Thank you. This is on? Great.
Yes.
You need to talk close to the mic.
We're going to have to make a little make do here, so we'll see how it goes. Let me do this. So we got the picture up on the screen. So for you, maybe I don't know if you want to move over this way, bring your chair, or if you can see on the screen there. But I have my presentation notes underneath each slide. Unfortunately, this is not going to be possible, so I'm going to kind of read some of the stuff off my cell phone. But we're going to make it work here. So we're going to talk a little bit here today about a very sensitive topic. And it's now officially called it's officially now called type 3 diabetes.
Oh, wow.
Dementia and Alzheimer's, because there's such a lot of people that are struggling with this and suffering from this. And so it's almost more scary to be diagnosed with dementia than what it is to be diagnosed with cancer.
Mm-hmm.
And so people are very concerned about this. So dementia is widespread. It's reaching very high proportions. It's a bad diagnosis. Nobody likes to be diagnosed with that. They estimate there's about 15 million caretakers and people taking care of people, spending billions of hours taking care of people who suffer from dementia and Alzheimer's. And this is taking a huge toll on the caregivers, who find it very, very difficult to navigate their way taking care of people that suffer from these things. Over the last 20 years, believe it or not, 270,000 papers has been published on dementia. That's more than 100 papers every day. And it's still going on today. And despite all of that, we still haven't come up with a cure. We still struggle and as to what is really going on. Not much progress has been made. And one of the senior researchers at the American Alzheimer's and Dementia Society made this statement. He says, Alzheimer's is incurable, but it is preventable. Okay, so, we used to say the same thing about mental illness. So somebody, once you've got depression, once you have anxiety, once you have all these things, take these medicines, take it for the rest of your life. You can't do anything about it. As a matter of fact, we used to say this about high blood pressure. Mm-hmm. And a patient comes to you and say, hey, doc, I've got high blood pressure, take this medicine. Doc, how long do I have to take this medicine? Well, for the rest of your life. Okay? And we also said the same thing about heart attacks. Once you've had a heart attack, a piece of your heart has died, you're never going to be the same. But we now know that we've now discovered ways to rehabilitate people properly, and many guys are now in better shape after their heart attack than what they were before they had the heart attack. Mm-hmm. Mm-hmm. Because of all the things that we do and know how the disease process works, people are now healthier, fitter, and can do more things after they've had their health event. And so we're going to look at a few things here, because it's not just all doom and gloom when it comes to dementia and Alzheimer's as well. But prevention is always better than going for cure. Mm-hmm. Okay? Mm-hmm. It's always better to look at this beforehand. Many times I have people that come in to see me in the office, and then they are very concerned. They want to get these tests done. They want to be tested for this. They want to get a cancer screen, and they want to get mammograms and PSAs, and the list goes on and on and on. I've got to get my colonoscopy, because I want to know whether I have colon cancer or not. And then I say to them, well, if I make the diagnosis of cancer on you today, how is that going to change your life?
Amen.
And so they say, well, the guys who smoke, I'm going to stop smoking, and the guys who are overweight, I'm going to lose weight, I'm going to start eating better, and the guys that have all those things, they say, well, I may spend more time with my kids, or maybe I'll spend more time with my wife, maybe I'll go on that vacation. that I've always wanted to before I die. And then I say to them, why don't you do it now anyway? Why wait till you get diagnosed with cancer before you make a change? Do it now. Take that vacation. Spend time with your wife. Go out with your kids and spend time while you have your health. Why wait till you die before you do these things? And so I think we need to change the way we think, because whether we like it or not, all of us, as we sit here, have cancer right now. I have more than 1 million cancer cells floating through my bloodstream right now. But I will never know about it because my immune system takes care of it. Because every day we are exposed to free radicals, chemicals, all kinds of things in our daily lifestyle that causes damage to our DNA and to our cells that brings cancer. But your immune system picks those cancer cells up and they take care of it. And you don't even know about it. Now the problem when you look aggressively for disease, what's going to happen? You're going to find it, okay? You're going to find it. If you look for something, you're going to find it. And many times, people find things and get treated for stuff that would never have caused them 1 minute of grief. And particularly with cancer, this is a major thing, or even with Alzheimer's, or even with any of these kind of things, it can really radically change your life. Your insurance, your insurability, your premiums, all kinds of things that you now suddenly have to write on your history that I have this or I have that. Because once you get labeled, you're labeled for life. Many times people get diagnosed with things that never leave them. And they can never get back to being healthy again. And so we've got to be very careful how we go about. You know, if I was going out on the street here and I catch the first 100 people that walk by, and I do an MRI on each and every one of them, do you think I'm going to find something? Absolutely. The moment I find something, I've changed a normal person into a patient. Now I can make money. Okay? Once I have patience, I make money. And people don't realize that medicine is a for-profit business just like any other business. My business is I sell or collect disease. The more disease I can find, the more money I make. So why look for disease? Live as if you have something wrong and do the things that's necessary to prevent that. And then if the symptoms come to a place where it bothers you, then go see the doctor. But many times today, they promote that we need to aggressively look for all these things. And when we look for all these things, we find them, and then we end up being treated for things that we should never have been treated for in the first place. And so there's a fine balance that we need to strike with all these things in order to make it work. Sorry, my phone switched off here. Let me just get it back on again. The brain is an absolutely amazing organ. It only weighs 3 pounds. It has only 2% of the body's weight. It consumes 25% of all your body's energy. And especially today, when we are, again, and that's a topic for another time, everybody's into low carb, keto, high protein diets. Okay? The primary fuel of your body, of every single cell in your body, is only one thing: sugar. And it's the simplest form of sugar, which is called glucose. But we've totally demonized these things, and now we want to stay away from that. Your brain cannot burn anything else but glucose. If you don't feed it glucose, you go into a brain fog and it dies. And it doesn't function properly. Your other parts of your body can take fats, they can take proteins and convert them into sugar and use it that way. Your brain cannot. If it doesn't have glucose, it malfunctions. So it's important for us to realize that, because that determines on what kind of foods and things we eat on a daily basis. There's 87 million neurons in your brain. And you know, most people don't, you know, we live in America, you know, we talk about billions like it's money we take out of the back of our pockets, okay? But people don't realize how much a billion is. You know, if I was to tell you a million, how many of you want to be millionaires?
Yeah, right.
And we all want to be millionaires, right? You know how long it takes to count to 1 million? If you count 1 per second and you count day and night, how long does it take to count to 1 million? 9 days, night and day, to count to 1 million. How much does it take to count to 1 billion?
11 years.
Try again. 31 years,
Wow.
day and night,
Wow.
1 billion. Do we have some billionaires in the world? Yes, we do. Okay, they've got a lot of money. Okay, that's a lot of money. You know, and that's just for billion. 31 years. The United States has a debt deficit of what was it? 3 something trillion. Yeah, trillion. You know how long it takes to count to a trillion?
Lifetime.
30,000 years to 1 trillion.
Wow.
Day and night. That's a lot of money.
Wow.
But, so there's 1 quadrillion connections between all these little brain neurons and all these little cells that's in your brain. And so these things are amazingly complex. You know, we can look at any computer in this world that makes, compared to the brain, it's child's play.
Mm-hmm.
We are so interested now in AI and all the things that AI can do, and it can do amazing stuff. But AI and all the computers that do those things can only scan data banks and come up with solutions to your problems. It cannot cognitively think and reason. And so it can only do things what it's been programmed to. So it can go through a whole lot of information very quickly and come up with a solution, but it cannot find new solutions to problems. And the brain can do that. Because God made us like that so that we can choose to follow Him or choose to reject Him.
Amen.
And so we need to use our brains to bring glory to God. So 50% of all the body's oxygen every minute is taken up by your brain. Think about that. 50% of all the air you breathe, all the oxygen you breathe every minute is taken up by the brain. So there's a whole brainstorm hurricane of free radicals that are being formed in the brain that can cause damage. And that's why it's so important for us to protect our brains in such a way that we can not have these damages cause us long-term effects and things in our bodies and in our brains.
Amen.
So there's different kinds of dementia. We're just going to go through some of these things very quickly. Dementia is an umbrella term for the loss of memory, thinking, and the abilities can be severe enough to interfere with our daily life. So there's Alzheimer's, which is the one that we mostly know of, and everybody talks about that. Then there's vascular dementia, which has to do with blood flow, Lewy body, and frontal temporal lobe, which are just kind of different sub-categories of different kinds of dementia. Huntington's, which has to do with copper and things in the brain. And then there's mixed dementias, and many of those other kind of type of dementias. But the main two is vascular and Alzheimer's dementia. Now, when we talk about vascular, it has to do with your circulation. But if we talk about circulation, we've got to realize, Ellen White wrote and told us that the life is in the blood.
Mm-hmm.
All right?
Mm-hmm.
And it sounds like a simple layman's term of explanation. It's not scientific, so a lot of people have kind of brushed it aside and didn't pay much attention to it because it's not a very scientific statement. Okay, but when it comes down to the basics of things, all chronic disease has to do with how well that part of your body is perfused.
Mm-hmm.
How well is your body able to bring blood to that area? To bring oxygen, to bring nutrients, and to take away byproducts and things that can be harmful. So everything has to do with circulation. If you don't get enough circulation to your heart, you get a heart attack, you croak and die. If you don't get enough blood to your brain, you get an ischemic infarct, brain infarct, or a brain attack, and a piece of your brain dies. If you don't get enough blood going to your eye, to your retina, you get macular degeneration, right? Which is the number one reason for age-related blindness or losing of our sight. So you don't get enough blood going to your kidney, you get kidney failure. You don't get enough blood going to your penis, you get erectile dysfunction.
Mm-hmm.
Same thing, okay? It all has to do with circulation. If the circulation is not good, then that part of the body suffers and dies. And the same thing happens with the brain. If you don't have proper circulation and oxygenation of your brain, you get into a brain fog and your brain begins to not work properly. It's like getting a virus on your computer. It's slow, it doesn't want to do its thing properly, and there's brain fog going on. You can't think clearly, and you get depressed, and you have negative thoughts, and you get mental illness, and all the things that go with that. And you can't remember so well. And you have issues with dementia. So, over 11 million Americans provide unpaid care to Alzheimer's or other dementias. 56% of caregivers say that navigating healthcare systems are difficult, and 70% of the caregivers feel stressed when they are coordinating care for people. So this is a very, very stressful job. It's not an easy thing to do. Alzheimer's kills more people than breast cancer and prostate cancer combined, which are the two main killers, some of the cancers in the United States at the moment. Wow. And these are pretty new figures. This is out of the Alzheimer's Association, and this study was published in 2024, so just a year ago. So this is the latest figures on these things. 57 million people currently living with dementia worldwide. 153 million by year 2050, they estimate. $347 million current cost. Projected cost in a few years' time is going to be over $1 trillion. So these are just vague figures, but it just tells you this is a huge problem. Okay, 1 in 3 adults dies from Alzheimer's or other form of dementia at the moment in the United States. So there's a lot of problems with regards to how this works. Now, this is not a disease that comes upon you suddenly, like cancer or a heart attack or any of these kind of things. This is a gradual thing that comes on over time with aging. So there's a long preclinical stage when nobody knows what's going on and you don't have any symptoms. And nobody thinks or even knows that something is going on. And then suddenly you begin to get symptoms that can sometimes be very vague and very difficult to pick up on. And it's many times just people that live with you, your spouse, or your kids, or somebody that pick up, like, Dad can't remember so well anymore, and he's forgetting things, and he's asking the same question over and over again. And so we get what they call MCI, which is minimal cognitive impairment. So just a little bit of subtle symptoms begin to kick in, and then as time goes on, that develops into full-blown dementia, where we have more overt symptoms now to the point where the diseases begin to affect our ability to take care of our daily needs, and we can't take care of ourselves anymore as time goes on. Okay? So it starts decades earlier. And that's what makes it so insidious and so dangerous, because many times we don't even know what's going on. So the basic pathophysiology, what's happening here is that you have neurons that have little branches that branches off and make connections with other neurons, and many of these neurons have thousands and thousands of connections with other neurons. So it's not just one wire connecting with one wire. One neuron can connect with 100,000 other neurons in the brain. So it becomes extremely, extremely complicated. And then, in the case of Alzheimer's, you have amyloid plaques, which are protein plaques that are being deposited and disturbing these little nerve connections. And then when that happens, there's misfiring and things happening there, and wrong messages are being translated, which leads to brain atrophy. So the brain begins to shrink because it can no longer work properly. It's like a muscle. If you don't work a muscle, it atrophies. It becomes weak and it becomes smaller. And so those are some of the things that take place there. So vascular risk factors, hypertension, we know that, because hypertension has to do with circulation. Okay? Then diabetes, again, diabetes is a microvascular disease. It's really had nothing to do with sugar. Sugar is just a symptom. The problem is microvasculature is compromised because of blood viscosity that's going down. And that's why everybody wants to take an aspirin a day, a blood thinner, or something to make their blood more viscous so it can flow easier. And that improves your symptoms, but that's what it is. So vascular dementia brings cerebrovascular impairment, so there's not enough blood flow going to the brain. And then that leads to damage, and then these little amyloid plaques that are being formed and deposited in the brain. So, and that causes these problems when you have all these things. So this is the vascular risk factors of dementia, which leads to cognitive impairment, because now, you know, the brain can't work properly. So it's like a computer that doesn't want to do its thing, and it's the little spinning wheel of death, you know. And you're waiting and waiting and waiting. Come on, let's get the answer. And this takes a little time. This is what happens with our brains. It's just slow, and it doesn't want to do it. Can't remember. A word can't come to my mouth now. And we sometimes lose our tempers, or we get depressed, or we get anxious, or any of those kind of things, because our thinking is impaired. Dr. Neil Nedley is running the Depression and Anxiety Recovery Program, has done some research on this, where he's found now that's now across the board, they now know, because they've done PET scans. Dr. Amen has also done the same thing, where he's done hundreds and thousands of PET scans on people's brains, and he's now found that every single person with some kind of mental illness, whether that is OCD, post-traumatic stress syndrome, anxiety, depression, bipolar, ADD, ADHD, doesn't matter which one you use, every single one of them has a decreased blood flow to their frontal lobes. And the moment you repair that and get the blood back there, the chances of people recovering from their mental illness is way, way higher.
Amen.
And that's one of the reasons why in the Nedley Depression and Anxiety Recovery Program, one of the key modes of treatment is hydrotherapy. Because hydrotherapy is shock therapy, which brings blood flow to your brain. And they can actually, within 7 days of consecutive hydrotherapy, show on a PET scan that there's an increase of 30% of blood flow to your brain just by doing that.
Wow.
Just one intervention. Wow. So this is huge, and we've known for many, many years the benefits of hydrotherapy. Okay, but for some other reason that's kind of fallen by the wayside. We don't, the traditional mainstream medicine no longer uses it. Right. Okay, it's old school. It's quackery. Right. Okay, so that's a problem. All right. So when we look at some of these factors here, what are some of the risk factors here? They are non-modifiable risk factors. Age and genetics. Okay, we're all getting older. The older we get, the higher the chance of getting dementia or Alzheimer's. So let's not talk about the things that we can't change. Right? We live in a sinful world. Things happen. Bad things happen to good people. Sometimes, you know, we all have things that happen in life when we look at it and we say, life isn't fair. Okay? We all have Uncle John in the family who lives like the devil himself. He smokes and he drinks and he does whatever he wants, and he's overweight and he never exercises, and nothing seems to ever go wrong with this guy. Okay? He just keeps kicking. Right? We all have somebody in the family like that. Okay? A bad advertisement. Okay? But we also have grandma who never smoked, never drank, never done anything bad in her life. And she gets lung cancer. And you think, what in the world? Where did that come from? We have an enemy. And sometimes bad things happen to us and we have no explanation for it. And it's okay, you know. When Jesus was on the cross, he also asked, my God, why? Why have you forsaken me? Did he get an answer? No. He didn't know either. Okay? He didn't always understand what was going on totally in his humanity. So we don't always have all the answers, but we can still continue to trust in God and know that he has the final answer, and he will see us through even if bad things happen to us. And so, yes, so let's not talk about that. Let's look at the modifiable kind of things. Cardiometabolic. So circulation And particularly things that are related to diabetes are some of the things that we need to look at and say, okay, what can we do to change those things? Sorry for that here, let me just get that up. So that's one of the things. And you know, one of the things that totally amazes me, I will get people still today that come through my doors in my office, and then when they get diagnosed with hypertension or with high blood pressure or with diabetes, people are extremely blasé towards these things as if this is just a cold. Give me this, my antibiotics, so I can get better. They don't realize the effects that these things can have on their health and what can actually happen to their hearts and to their brains when these things happen. And so it amazes me that cholesterol as well. Just give me my statin, you know, and I still want to continue to eat what I'm eating. And just give me my blood pressure medications because this lifestyle stuff doesn't work anyway. And so people just have this very blasé kind of attitude towards this. And as Adventists, you know, we've always taken a very strong stand for health reform.
You know?
And when it comes to smoking and drugs and those type of things, we've always taken a very strong stand. I wanted to put into that list alcohol, but unfortunately, there are many of us that don't have the same stance against alcohol anymore. Mm-hmm. There's many, many people that have become social drinkers and saying that a little bit of alcohol here and there is not going to kill you. It's not bad, and it's okay, and has caused a lot of people a lot of troubles. I won't even mention caffeine because we've totally lost the war of caffeine.
Right.
Okay. But you know, 30-40% of Adventists nowadays drink coffee on a regular basis and see absolutely nothing wrong with it and doesn't see that there's any issues involved with it, because we take some of the research that have been done by industry,
pure science, and
say, yes, you know, there are some benefits. Yes, you know, there are some benefits. Are there some benefits to sin?
Yes.
Absolutely, okay? It's fun, okay? It's lots of fun, okay? There's some things, the devil doesn't catch us with 100% poison. He takes truth and he mixes it with error. And he kills us slowly over a period of time. Yes, there's some benefits to some of these things, but we have to not forget that there's also detrimental effects that will, in the end, kill us, because we know that the enemy has come to destroy and to kill, and he wants to destroy and kill each and every one of us and take us away from what God has in plan and in store for us. So we can't just look at things at face value. Yes, there are some benefits, there are some things, and there's some studies that show some of these things, but in the long run, there's more disadvantages than benefits for these kind of things. What about exercise? You know, as Christians and as Adventists, we've done very poorly on the exercise part. Mm-hmm. Mm-hmm. And we all know the benefits that exercise can bring. So we do need to really look at these things and realize that we can learn and continue to learn and continue to grow. Cholesterol, obviously, is one of those. So, you know, we've known about cholesterol for a long time, but people struggle still with it because they don't want to give up the favorite things that they know is causing some problems with cholesterol. We're going to talk a little bit about that. Blood pressure, glucose metabolism, lifestyle, diet, you know, physical activity, smoking, alcohol, and other social and cognitive activities are things that are risk factors that can help, that we need to do in order to help us with these kind of things. And, you know, out of the Breslow study, which was done many years ago out of California, where they had hundreds and thousands, over 450,000 people was in the study. So this is a huge retrospective as well as prospective observational studies that was done. And what they found there was, and this is something that very few times are quoted amongst Christian circles, and that is what they found was that people who smoke and heavily exercise live longer than people who don't smoke and don't exercise. Mm-hmm. Mm-hmm. And you know, many times it's so easy for us to point fingers at other people, you know, when people struggle with certain things. What about us? Do we struggle to get to the gym and get some decent exercise every day? Yes, I don't smoke. Yes, I don't drink. Yes, I don't drink caffeine. Yes, I do all these other wonderful things, okay? But many times we miss the elephant in the room. And So we need to be very careful. There are sins of commission. And as Christians, we don't commit sins, not very many, okay? But we omit to do what is right. And so there are many things that we omit to do because we get so busy with life and all our other things and the things that we want to do that we omit to do the things that we know that are good for us. And exercise is just one of those. So there are many evidence studies that has been conducted. We're just going to go through some of these that shows that there are evidence for prevention. And there's tons of studies like that. The Mind Study, Framingham Heart Study, Women Health Initiative by Harvard University, Women Health Study also by Harvard, Washington Heights and Inwood, Columbia, Aging Project, Health Professional Health Study, Adventist Health Study out of California, the Alzheimer's Cohort Consortium, Cognitive Function and Aging Studies, Cardiovascular Health Study, Northern Manhattan Study, Finger Study. There's tons of these studies that have shown that these things do work and the things that we need to do. So let's look at the population risk for Alzheimer's. So if you have a genetic, and they can now do genetic testing on you to see if you have a tendency towards developing Alzheimer's, when they look at specific genes. They found that if you have the risk, if you have the gene, then you have a 60% increased risk of developing Alzheimer's or dementia, either form. So if you have a genetic factor risk and you live and eat the standard American diet, the SAD diet, you have a 360 increased risk for dementia. And that's the reason why dementia is so high in first world nations in the world, because of the poor diets that we eat. Okay? If you have a genetic risk, and this is where the good news comes in. If you have a genetic risk and you follow a healthy lifestyle, you have a less than 30% increased risk, despite the fact that you have the gene.
Amen.
So our genes is not our final destiny.
That's right.
Okay? I mean, many times I will ask my patients, and will say, oh, my mom was like this, and my dad's like this, and so-and-so is like this, and all these kind of things are going on, and all these diseases that run in the family, And so I would tell these people, don't tell me about your mommy and your daddy. Tell me about what do you eat. Okay, I don't want to hear about mommy and daddy. Okay? And when I went to medical school, I was taught that you have to find out, because genes and genetics play such an incredible role. But we now know, since we've discovered epigenetics, we know you can switch genes on or off by the lifestyle choices you make. And so your genes is just a pointed, loaded gun to your head. But you hold the trigger.
Mm-hmm. Mm-hmm.
And if you make the right lifestyle choices, that gun never has to go off. And so that choice is in your hands. You can choose to pull the trigger or not by the lifestyle choices we make. So it's important for us to realize that. Yes, there are things that run in families. Habits run in family. Diet and lifestyle runs in families. Okay? I die like my dad because I eat like my dad. So, but we can change that by the choices and the things that we make on a daily basis. So that's just another point that I wanted to bring out for us to understand here. So preventing Alzheimer's is our most urgent healthcare priority. We've seen that already. There's studies that have shown that, and that there are lifestyle interventions that can be done that can help to halt and somewhat reverse and deal with some of these issues that are prevalent in dementia and Alzheimer's. And so this is what this researcher has come up with here. This is the latest studies. This is a study that was published in JAMA, Journal of American Medical Association, in 2024. And some of the studies are all in the 2020, so it's all the most recent research on this topic. So these are the 5 pillars that they base their treatment on. Nutrition, exercise, unwind is for stress management, restorative sleep, and optimizing your cognitive activities and things that you can do to help. So let's look at nutrition. The Mind diet on Mediterranean diet and the DASH intervention focused mostly on plant-based foods linked to dementia prevention. So these are some of the studies that have shown some of these benefits. Okay. Analysis of the diet and other factors found that after an average of 4.5 years, this is just very short years, 4.5 years, people who adhered mostly to the Mediterranean diet had a 53% reduced rate of Alzheimer's disease compared to those that did not follow the diet. And that was observed in only 4.5 years. The study was published in 2015. So there's some significant impacts that we can make with these illnesses if we just follow a Mediterranean. Now, is the Mediterranean diet a perfect diet?
No.
By all means not. It's not the perfect diet. Yes, it's a diet that's high in vegetables, it's high in fruits, it's high in grains, it's high in nuts and seeds, legumes, it's got monounsaturated and polyunsaturated fats and all those kind of things, and it's got omega-3 fatty acids in it, and that's good. It's a diet that's low in meat and in dairy products and low in saturated fats and those things, but it's by all means not a perfect diet. Okay? But even just following it for 4.5 years gave a 50% reduction in the incidence of Alzheimer's disease. Another study here, also 581 participants with no dementia. So this is a retrospective or a prospective study. So they looked at people with no dementia, waited till they died, then did autopsies and looked at what was going on in their brains. All right? So what they find, higher adherence to the mind or the Mediterranean diet resulted in less amyloid plaques and younger brains, 12 to 18-year difference. Now, folks, that is significant differences there. Okay? That is very, very significant. Okay? When you look at the amount of benefit that you can get there. What about whole grains for the brain? 2,958 participants, 61 years and older, followed them for 12.5 years. The highest intake of whole grains, 34% lower risk of dementia and 40% lower risk of Alzheimer's disease, with the benefits appearing to plateau at around 2 servings per day. So not the more you eat, the more better you're going to get, kind of leveled off at about 2 servings per day. And that was also an incredible study there. They did some other studies as well, and especially now, I'll say something about some of this now. You know, gluten and wheat has gotten a lot of flack in the last few years. You know, people blame everything, and so now they don't want to eat wheat anymore. And so we're going to look a little bit about what it says about gluten and about wheat and the effects of that. Very few, only 20% of Americans eat breakfast on a regular basis. And of those who eat breakfast usually consists of a donut and coffee, hash browns, biscuits and gravy. There's no fiber, there's no grains, and there's none of these benefits. So we do need to rethink about how we do breakfast and what kind of foods we need to eat there. Another study that I just skipped here that I wanted to just mention, also a study done by Harvard, 16,000 women from the Nurse of Health study. And what they did with these people, they gave them 1 to 2 servings per week of blueberries and strawberries. And it showed a 2.5-year slowdown of the onset of Alzheimer's. Just 2 servings of berries per week. Now, people will say, well, 2.5 years out of an 80, 90 years life, I mean, that's not even 5%. But you've got to remember, you don't get Alzheimer's when you're 10. Okay? You get Alzheimer's when you're 70 or older. So when you look at it from that point of view, 2.5 years in the last 10, 20 years of your life is significant. That you don't have to take care of somebody, you don't have to pay and spend a lot of money, and you don't have to expend a lot of energy and manpower to take care of a person. 2.5 years is a significant number of years. So yes, there are benefits with these kind of things. They did another study also at Harvard where they not even gave people the actual food to eat, they gave them juice. They just gave them like Concord grape juice and some other fruit juices. And even with that, they saw the same benefits. They saw the same benefits. So there are many, many of these things that are just positive things that we can do to benefit us with this. Whole grains are filled with vitamin B complex vitamins. If you don't eat whole grains, you are going to be short on B12, B1, B6, and your other B complex vitamins. So you're not going to get enough. And so it's important for us to do that. And like I've said before, people are so obsessed with GMO-modified grains and wheat and all these kind of stuff that was going on. And so now they don't want to eat any gluten. They don't want to eat any wheat anymore. And so I just want to mention something just here that I think a lot of people don't think about. We all know about the Adventist Health Study. Okay? Adventist Health Study of California is one of the longest longitudinal studies in America. It's been going on for more than 50, up going for 60 years now, where they followed thousands of Adventists, because the Adventists are a unique group where you have non-vegetarians, people that eat regular sad diet, then you have vegetarians, lacto-ovo, and then you have vegans. And so you had a perfect study group where the rest of their stuff are pretty much the same, but they have these main differences, and so I could follow them for cancer risk, cancer prevalence, heart attacks, and dementia, and a whole slew of diseases, and so they would follow these people. And you all know that what they found was the difference between those who were just eating the regular diet and those that were vegans. Men live 11 years longer than their counterparts in California. Now, I'm going to ask you just one question. How is it possible that people living in California, breathing air-polluted air, drinking faucet regular water, not reverse osmosis water, eating GMO-modified vegetables and stuff, they didn't eat organic things, okay? They ate all the regular foods. The only difference was they changed their diet from eating the standard American diet to eating a vegan, plant-based diet. They were still able for men to live 11 years longer, and if I don't have time to go through all the other things, but there's 80-90% decrease in cancers, decrease in rheumatoid arthritis, multiple sclerosis, and the list goes on. All these chronic diseases, just by doing that one thing. Do we need to absolutely go for all these finer things and stuff? Well, I don't want to eat this, I don't want to eat this because this is GMO modified. No. You get 80% of the benefit by just changing from a standard diet to a plant-based diet.
Amen.
The last 20% you get by changing to organic and by changing into drinking more purer water and stuff. Do we need to strive for that? Yes. But we don't throw the baby out with the bathwater. Okay, because I can't get proper wheat, now I'm not going to eat any wheat whatsoever. It's worse for you not to have any wheat than to eat wheat that is GMO modified. And so we need to think about these things in a proper way. The elephant is in the room. Let's get rid of the elephant. And the elephant in the room is we need to get rid of the amount of animal products that we eat on a regular basis and fill it in with plant-based foods. Now, if you can grow your own foods, and if you can get organic farmers that can provide you with organic substances, great, go for it. But not everybody can. And if you can't, you just go to Walmart and you buy what you can get there. Okay, even though it is GMO modified. So, we need to realize that any change is better than no change.
Amen.
And so let's make a change. Let's do the things. We don't have to be total vegans. When you look at the blue zone studies around the world, you will find that, yes, these people are not total vegetarians. They eat meat once a week. Okay? And so, and they still get a lot of benefit. So, yes, if we can be total vegan, that's okay. But move towards that end. And the more changes you make, the better your benefits will be. Nurses Health Study, 13,000 nurses, women followed for 8.5 years in this study. And they found there were no association between gluten intake and cognitive scores. So all these people that tell us, hey, we can't eat these things because it's going to give us brain fog and it's going to cause all kinds of problems. Long-term gluten intake was not associated with cognitive scores in middle-aged women without celiac disease. Now, obviously, if you have celiac disease, yes, then you have problems, and you need to be treated in the proper way for that. But if you don't have celiac disease, and most people don't, okay, you will do just fine by just eating the wheat. Dietary fats and the risk of incident of Alzheimer's disease. This is a study out of Chicago, 2,500 older adults. Higher amounts of saturated fat and trans fats gives a higher risk of Alzheimer's disease. And so this is not just for older people. This is, in the study, is also shown for even younger people who have higher cholesterol and don't take care of that early. It's going to have problems for them later on in life if they don't deal with their cholesterol in a proper way. So midlife serum cholesterol, this is what they found out of Kaiser Permanente. 9,900 patients followed for 3 decades. Individuals with high cholesterols, even in midlife, had a 57% higher risk of developing Alzheimer's disease later in life. So borderline high cholesterol increased the risk of Alzheimer's by 23%. So we need to deal with these things and get our cholesterols to a normal level. Lowering LDL lowering therapy and dementia risk. You know, I always get this question. So if I take a statin, is it going to benefit me? They've done studies on that. And the studies actually shows yes. Okay? A statin does lower your risk for developing dementia and Alzheimer's. Okay? But you see, this is not one of those things where you need to say, well, should I take the statin or should I not take the statin? Because I need to look at the side effects of the statins. Okay? Yes, there are some benefits. Are there some benefits for caffeine? Yes, there are some benefits. But the disadvantages, in my opinion, with regards to statins outweigh the benefit. Because there are other ways that you can use, more natural ways, better ways to lower your cholesterol other than taking a statin. And then you don't have to deal with any side effects. So I don't recommend statins, but I just wanted to throw this in there. So if somebody talks to you, yes, statins does lower the risk. And it's up to each individual to decide whether they want to take that risk or not. And if you want to take statin and say, yes, I'm willing to take the risk, that's up to you, and you can go from there. What about ketogenic diets? This is one of the latest things here, high-protein diets. The first human randomized controlled trial of keto diet in patients with diagnosis of Alzheimer's disease. This is just a small group. That was only 21 patients for 12 weeks. That did not show a statistically significant improvement in cognitive scores. And I'm not surprised by that because the ketogenic diet is an acidic diet and it causes inflammation in your body. And so, but this is a very, very small study, so a lot of people will not put a lot of validation to this. So there's quite a bit more research that needs to be done on this topic. What about omega-3? The jury is out on omega-3. Omega-3 is probably the most studied supplement when it comes to brain health, and the benefit is there. The more omega-3s you eat, the better your brain works, and the lower your risk for Alzheimer's. Supplementation necessary or not? B vitamins, especially B12, yes, that's important for especially vegetarians, and for most people, it's good to have some B12 supplementation. Folic acid, if you want to take a folic acid, if you don't take enough greens and enough vegetables in, yes, you're going to have some problems. Vitamin D, we live in a little bit of a northern climate here, and people are scared of the sun, they don't want to be outside. We work indoors, so we work under artificial light, and so, yes, most people are vitamin D deficient, and it may benefit you to take some vitamin D supplementation. For the other micronutrients, vitamin C, E, and minerals, best to get them from foods rather than from supplements. With supplements, even though they're natural, they're drugs. The moment you take something out of its natural environment, it becomes a drug. So, dietary pattern for brain health across life course: unprocessed plant-based or plant-based predominant diet, reducing your saturated fats, More plant proteins from lentils, beans, and soy, because it doesn't have any saturated fats and stuff in them. And then complex carbs inclusion. So we need to have not simple sugars, but complex carbohydrates. That's rice, potatoes, corn, sweet potatoes. Those things need to be the bulk of what's on your plate. It's bulk forming foods, and it's all complex sugars which will feed the brain. And it also then obviously increases your amount of fiber that you take on a daily basis. And then obviously your omega-3 fatty acids. So let's look at exercise, okay? Exercise brings about neuroplasticity in the brain, okay? It grows your brain connections by the thousands per cell, just from exercise. And the reason for that is because you bring circulation to the brain. There's oxygen, there's blood that comes there. BNF, brain-derived neurotrophic factor creation, this is a hormone that's responsible for brain growth. So we now know that you can actually change the shape and the size of your brain. We used to think that brain tissue, once you've had a stroke, it's dead, it never comes back. That's just not true. You can actually grow your brain up till the day that you die, if you do the correct things. Reduces insulin resistance, exercise does that, and significantly reduces depression, anxiety, and attention deficits because it increases blood flow to the frontal lobe, and it reduces the prevalence of vascular and neurodegenerative diseases. So we've known this for a long time. Exercise is a good thing to do. How much? Daily brisk walks resulted in a 40% lower risk of developing Alzheimer's later in life.
Wow.
You don't have to go and run a marathon. You don't have to do something crazy. Just walking every day. Just walking every day. And that was from the Framingham study, which will benefit you. What about resistance training? Weight training, okay? Resistance training is often ignored, but it's an essential component of brain health, especially for older adults. Weightlifting significantly enhances cognitive function in both cognitively healthy individuals and those with cognitive decline. So it's beneficial for us all to be able to do some exercises, weight training, and not only is it good for that, it's good for a slew of other things as well, and so we're not going to get into all of that. But there's a lot of other things that you can get benefit from as well. So, effects of resistance training, 2 to 3 times a week for 6 months in a group of older adults with minimal cognitive impairment. Okay, and this is what they found. 47% of participants achieved normal cognitive scores after the intervention. Think about that. These people were actually diagnosed on a mental health test with minimal cognitive impairment. So they couldn't remember the numbers that they were given, they couldn't recall certain things, they had some definite cognitive issues, and in a period of 6 months, exercising 2 to 3 times per week, they were able to reverse that. And what they found was that greater leg strength was extremely effective at improving cognitive performance. So the stronger the people were in the lower parts of their bodies, the better they did. I'm just going to share something with you. Most of the old people that come to my elderly, that come to my clinic, if I ask them to get out of their chair without using their arms, they can't do it. In other words, they can't get off the toilet without help. That's a problem. If we can't come up and we don't have enough strength in our core to get us up out of a chair without pushing ourselves up. And there's the evidence for it. If we do those kind of things, it also improves our brains and the way that we do there. And so amazing study there. So exercise summary, regular moderate strenuous activity grows the brain. We've seen that. Sedentary behavior nullifies the effect and the benefit from strenuous exercise. You've got to keep doing it. Leg strength is associated with a bigger brain. So we've got to do that walking. We've got to climb those stairs rather than taking the escalator. Climb up the stairs. It takes you a little longer, yes. You know, and if you have issues with your knees and stuff, don't come down, but go up. Come down with the elevator, okay? But go up so you can get some exercise there. Engage in strength training at least 3 times a week. engage in vigorous aerobic exercise at least 3 to 4 times a week. That means when you go for a walk, you don't just stroll and walk the dog. You need to put some energy in there, so get up to 3.5, miles per minute, so a 15 minute, 16, 17 minute mile to get up there. And then regimented, continuous doses of exercises are needed for neuroplasticity. So you need to keep at it over a period of time in order to get the brain to start doing the things there that it needs to. All right, stress. What about stress? Okay. Chronic stress and neuroinflammation. Chronic psychological stress can trigger neuroinflammation, and the process is they're increasing the levels of pro-inflammatory cytokines, which may contribute to neurodegenerative and can develop dementia. When we don't get enough sleep, we get stressed out, in order to be able to function the next day, the adrenal glands have to release cortisol. Okay? And when the cortisol is released, then you can function. But chronic high levels of cortisol causes all kinds of inflammatory issues in the body, which causes brain damage. So it's important for us to get away from that and have the tools in place so that our bodies can repair and our brain can repair, and we don't put our bodies under a lot of stress. Because stress will actually atrophy your brain over a long period of time. So it's important for us to do that. Chronic stress may exacerbate the accumulation of amyloid and beta-tau proteins, two of the key pathological features of Alzheimer's disease, by impairing the brain's ability to clear these proteins from the system. So you need to be able to get it out of the system. Many times we go to Disney World, and when we walk around there, we marvel at all the plants and the flowers, and everything is cut, and all the lawn is cut in the same direction, and everything looks clean. There's not a paper that lies around, and everything is good. And then we complain because there's all these people. You've got to stand in line to get on a ride, and all these kind of things going on. But did you know that Disney World is actually more busy at night than what it is in the day? Has anybody of you visited Disney World in the middle of the night? Everybody is out there. You can't speak to yourself. Because the lawnmowers are out there, the weed eaters are out there, the guys, picker-uppers out there, everybody's there, they're working on the computers, they're doing all the maintenance. There's all kinds of stuff happening at night. So that when the day comes, you and I can enjoy the perfection around us. The body works exactly the same. At night, your brain is active and working to clean up all the mess and all the stuff that you've done during the day and all that free radicals that is being released in your brain because of all the thinking and stuff. Think about it. Look at all those connections there. You leave your computer on just for a little while and the thing gets hot, okay? And the fan comes on. What do you think happens in your brain with all that interactions and stuff going on there? It gets warm, it overheats, and there's damage that takes place there. And at night, that's when these repairs take place. And if we don't live a low stressful life and get enough rest and sleep, and we're going to talk about that as well, then these kind of things becomes a problem. So we need at least 5 REM sleep cycles every night in order to get up the next morning rested. So 6 hours would be the minimum that people can get away with. Anything less than 6 hours, that's when we begin to run into problems. Preferably around 7 to 8 hours is the perfect number of sleep time. So there's a lymphatic system in the brain that cleans the brain and that helps with memory, consolidation, and organization. That's why when you study, the best thing to do after you've studied in order to remember something is to sleep. Then the next morning when you wake up, you're much more able to recall the things that you've learned the day before. So cramming to just before the exam and then walk in doesn't really help. Doesn't really help. It's better to stop way before the time, get a proper rest, and then you'll be able to recall much better the next day. So we do need those kind of... So that's a picture that actually now, for the first time, through a PET scan, able to get a picture of the brain to show this is daytime, and the other one that's lit up like that is what happens at night in your lymphatic system, where the brain is busy cleaning and helping it up, and the brain waste clearance system shows in people for the first time. This study was published here in 2024, so it's just last year that they were able to actually show this on a specific PET scan. So this is exciting to be able to see that and see how these things actually work. So sleep disorders and Alzheimer's, those people with sleep disorders need to address these things so that you can help, because it does lead to cognitive impairment and Alzheimer's. So see somebody that can help you. Same thing with obstructive sleep apnea. People that snore and that have issues there with the breathing, those things can also be a problem. Sleeping less than 7 hours compared to 8 to 9 hours was associated with twice the risk of developing Alzheimer's or dementia. So insomnia, and this is a major problem because of the lifestyles we live, under artificial light, we've got screen time, we're doing things that stimulates our brains and gives us blue light radiation to the eyes and keeps us awake, reduces our melatonin productions in our brain. So these things are a problem. Sleep disordered breathing by 22%, and other sleep issues like excessive daytime sleepiness and self-reported sleep problems, 34% increase in the potential risk for developing Alzheimer's. So yes, we need to address those kind of things. So sleep hygiene. Environmental factors, sound, light, temperature, get your room right, get it dark, get it quiet. Restriction of caffeine, alcohol, and excessive calories at bedtime, so make sure that you create an atmosphere where you can fall asleep. Cognitive behavioral therapy for insomnia, yes, that helps a lot. So you may need to see a counselor or a therapist that can help you, because it has to do with the way we think. Identifying sleep disorders, so sleep apnea, restless leg syndrome, and other sleep disorders, breathing, see your physician and get that sorted out. So the last one is how do we optimize our brains? Okay? Our optimizing of our brains is because of the synaptic connections needs to be protected. So we need to stimulate our brain and make it work. Okay? Cognitive reserve is a source of resilience. Complex activities is important. Okay, because it's associated with increased brain capacity and size. So just because we're older doesn't mean that we, don't want to do or read or study or things anymore. The more we engage our brains, the more active it will remain and healthy it will remain. So yes, we do need to do that. So they've done studies on this. They looked at the differences between brain sizes and cognitive problems in taxi drivers in London and bus drivers. So what's the difference between a taxi driver and a bus driver?
You gotta know where they're going, every place.
Yes, the taxi driver needs to know every time he gets a new person, he goes to a new place. The bus driver, he can drive his route with his eyes closed, because he knows. He's been doing it for hundreds and hundreds of times, over every single day. He drives the same thing. And what they found is that taxi drivers consistently had a larger hippocampus due to the complexity of their daily activities, just because they have to figure things out. There was a part of their brain that was actually better developed than the guys that were the bus drivers. More complex navigation led to more complex spatial knowledge, which in turn led to a bigger and more resilient brain. And so these are very, very interesting facts on this. The nuns study, they did the same thing there. Autobiographies 60 years after they were written, okay? Brain autopsy results, nuns with higher linguistic abilities earlier in life did not show evidence of Alzheimer's despite having abundant lesions of Alzheimer's in their brain. So even though they had all the plaques and deposits there, because they knew a different language and they learned another language. So sometimes, pick something up that you're going to learn. Learn some words when you go on an overseas trip. Learn some stuff that you can communicate somewhat with people of that culture or that place. And that stimulates your brain as well. Loneliness and dementia is probably one of the biggest problems in our society. We have got more media, more connection stuff, but we are more lonely than ever before. And because people stay at home, they don't want to go out, they just stay by themselves. Loneliness is associated with 26% increase in developing dementia, while limited evidence suggests a potential link between loneliness and mild cognitive impairment, highlighting the need for interventions to mitigate the effects of loneliness and cognitive decline. So if you're alone at home, your spouse has passed away, the kids are far away, and you're not around with somebody, take some time to volunteer some things. Go to church, volunteer there. Go to your local SPCA, take care of pets. Just go pet the dogs, pet the cats. or do something that where you are doing something outside of the house. Social activity and dementia risk. Social participation throughout life may be a lower dementia risk by enhancing cognitive reserve, reduces your stress, and improving your cerebrovascular health, with observational studies showing 30 to 50% potential reduced risk of dementia just by being involved in our society, being involved socially with other people. It's important for us to realize that. Just a quick thing here, hearing loss. They've shown now people who can't hear have a much, much higher risk of developing dementia because you can't participate in conversations. And many times people are embarrassed by this and they don't want to go to get help. And if they can't hear, they feel embarrassed and they keep on asking, oh, excuse me, can you say that again? It's like, go and get a hearing aid. Go and do whatever is necessary. Get a cochlear implant or whatever you need to do to be able to hear properly so you can participate and be part of the conversations. Because I've seen many times the older person will be in a conversation and the kids are there and everybody, and because grandma and grandpa can't catch on as quickly, they just kind of ignore it and everybody speaks over their head. And therefore they just switch off and they're not participating in the conversation. And you can do that for so long. But then after a while, you become totally quiet and lonely inside and it leads to dementia. So yes, this is a simple fix. So try and get help as much as you can with those kind of things. So what kind of cognitive activities are proven to be the best for the brain? It's complex, purposeful, and something that's a challenge to your brain. Don't do something that you're just used to and you know. Do something that's a challenge. That you need to read and check up a little bit. Core brain health principles. Reduce your brain damage, so optimize blood pressure, optimize your cholesterol, manage your glucose levels, prevent head injuries, eat healthier, stop smoking, reduce and eliminate alcohol, treat your hearing impairment, and manage your depression and your anxiety. And exercise regularly, engage in cognitive activities, be more socially engaged, and make sure that you get enough sleep. Takeaway message here, shift perspective from passive decline to proactive cognitive resilience. Don't wait till somebody makes the diagnosis. I get people that will come to me and say, well, I want to be tested. And they want to go for this test and that test. And I'm saying, how's it going to help you? It's going to make you depressed. If you're going to go for a test and the test says, hey, you've got X number of, or this level of cognitive decline, how are you going to feel about it? You're going to be depressed. Be proactive and start working on putting in place as many of these things as possible and focus on brain health as early as possible.
Amen.
I know that was a mouthful.
Wow.
Thank you so much.
Thank you.
A couple suggestions. We're running a little bit late, but that was wonderful, and I thank you. We don't have time to do audience questions, but what I suggest is that you come up afterwards if you have questions, but please don't one person hog his time. Ask your question and let somebody else have a chance. Okay, name tags, please give them